Hi guys, today we are going to be presenting on baby-led weaning as an effective approach towards discontinuing tube feeding. I'm Sabrina Matusko.
I'm Hannah White.
And I'm Kathleen Mittelstadt.
In the corner, we have a QR code that has our abstract and our resources if you'd like to view that. Our purpose for our review today is to determine whether or not the use of baby-led weaning was an effective alternative to traditional methods of tube-fed weaning. Our rationale is that there is a lack of literature regarding tube weaning despite the increasing number of tube-dependent infants lately and children around the world. Compiling this review, we have worked to learn of the most effective tube weaning method that can greatly reduce the number of tube feeding dependencies that can develop. And these can have a long-lasting impact on a person's quality of life. For our background, we have different approaches to weaning children off of tube feeding that are still being studied. Baby-led weaning is fairly different from traditional approaches as it allows for the child to be more independent and it follows child cues for feeding themselves. And children weaning off of tube feeds can also benefit from this approach.
For our methods, a systematic literature search of 8 peer-reviewed research articles between the years 2010 and 2020 were compiled using databases Medline, PubMed, CINAHL, eSearch, Wiley Library, and OTDBase. Some of the search terms used included baby-led weaning, tube feeding, feeding disorders, therapeutic, transitioning, enteral feeding, formula feeding, complementary feeding, and weaning. For our inclusion criteria, studies had to have been published within the last 12 years, published by a peer-reviewed journal, and needed to be pediatric focused, as that is the demographic of our review. For our exclusion criteria, studies 12 years or older, studies not in English, studies that are not peer-reviewed, and studies solely focused on the adult population were not considered. For our findings and results, 2 common themes were demonstrated: the significance of hunger cues and timing. For hunger cues, infants have better neurodevelopmental outcomes if they can demonstrate their competency for feeding through their behavior, muscle tone, reflexes, and acting on internal cues. Research also demonstrates that observing infant behavior and physiological maturation are better indicators of feeding readiness. Baby-led weaning has the ability to teach hunger cues as it maximizes learning about the post-ingestive consequences of food. The sensory properties of food with repeated exposures can become associated with post-ingestive effects, such as certain flavor or texture becoming associated with how satiating that food is. For timing, a sensitive approach is required to progress an infant's feeding skills along with their development to avoid aversive feeding behaviors in the future. Children who are introduced later than usual to textured foods often attempt to process solid foods using a liquid swallow or swallowing directly at the back of the tongue. Lumpy and textured food that lands on the back of the tongue produces a gag reflex, which is aversive to the child. An infant-led approach to feeding may positively impact critical developmental skills, such as improving gross and fine motor skills, as well as language development, as infants begin to engage in chewing, biting, and bringing food to the mouth during family meal times. In the research, it was also identified that children who are weaning from enteral nutrition often have reinforced negative responses to feeding. Weaning from tube feeding is a lengthy process that requires many considerations to support an infant's behavioral and physical health. Infant-led weaning was a more effective approach in tube feed weaning than traditional methods that have a biomechanical focus of hunger provocation. And the research demonstrates that a progressive, mostly outpatient settled, patient-tailored program of weaning from enteral nutrition is effective for the majority of tube-dependent children.
Some of our limitations included parent-reported data that could contain a bias. Large percentage of study participants were recruited through an online platform providing access to a large participant pool, but may have limited the diversity of the sample. And no identified studies specifically linking BLW as a method of tube feed weaning, and no concrete evidence to demonstrate effectiveness of BLW for tube feed weaning. Our clinical implications included occupational therapists and other healthcare professionals that can promote awareness of baby-led weaning as an effective method for tube feed weaning through parent education and in practice. In practice, when professionals are working with infants weaning off of tube feeds, it is important that they are trained to respond to feeding and stress cues when infants are exposed to new sources of food and texture. Occupational therapists can observe infants' behavioral cues and motor milestones in feeding through interventions that are focused on positive oral experiences and developing confidence in transitioning to first foods. In parent education, it is important to emphasize the evolution of feeding skills to allow for realistic expectations of an infant's feeding journey, and facilitating positive oral experiences is crucial for development of infant as feeding is necessary ADL. Suggestions for future research. While there are currently professionals and other caretakers using and documenting baby-led weaning as a method of tube feed weaning, further studies can be done to examine specific ways in which therapists use baby-led weaning in treatment and study long-term successes of treatment, and how the diagnosis and conditions of clients may affect this method of tube feed weaning. Thank you for coming to our presentation on baby-led weaning, and we hope you enjoyed and look forward to any questions you may have. Thank you.